to look past that. And so that becomes the relationship. Other things to kind of think about are things about the environment, particularly with people living with dementia, because one of the things that happens even more and more with people living with dementia is a filtering kind of thing, that there may be background noise, there may be a TV on, there may be kids and dogs and radios and things going out in the street that I, with my brain, can filter. But for the person living with dementia, all they hear is the furnace running. All they hear is the overhead page. So they may not be able to filter those kinds of things. So the more you can reduce your need to compete with that, the better off you're going to be. So this is the GEMS approach, which is looking at how dementia changes through time, how we change maybe in a day-to-day kind of thing. Claudia Allen is an occupational therapist, and she developed this approach. And Teepa Snow took some, and I did some work with it, and then Teepa associated it with GEM states. So just to go through it pretty quickly, we've got 6 different GEM states. The first one is sapphires, and that's you and me on a good day when you're flexible and you can adapt and you can see your perspective, but you can see other people's perspectives, and you can really truly value other people's needs and abilities. Well, that's not going to happen very often in our days, because very few people can be in a situation of dealing with abuse, neglect, and exploitation and be a sapphire. So we're not going to see that very often. The next GEM state are people who are diamonds. They're rigid. They still have language, but they've lost a lot of their ability to be flexible with that language. They get very concrete. So I have some specific kinds of strategies for this. And because what we'll often tend to do is try to explain, and what it feels like is we're arguing with the person. So if I say to somebody, if I say to Stephanie, would you unmute for a minute for me? Because you've talked with me before. You've unmuted and talked with me. So
do you hear me?
Yeah. So if Stephanie is the person living with dementia, and I say to her, well, Stephanie, when we talked last time, this is what you said, and now you're telling me something different. How are you going to feel about me?
That you are not understanding me, and that you're scolding me.
That I'm scolding you, that I don't understand you. Are you accusing me of lying? I would never lie. What do you mean you're accused? I would never say anything like that. I said my grandson did that. I would never say who's been talking bad about my grandson? And so they
or they'd say, I don't appreciate you talking to me that way.
I don't appreciate you talking to me that way. So that letting go of needing to be right and saying the magic words, and the first set of magic words we're going to use, I'm going to have you put them in the chat so I make sure you remember them. I'm sorry. And you can actually say them with me. I'm sorry.
I'm sorry.
I'm so sorry.
I didn't mean to.
I'm so very sorry, because if you don't say those words, you will be. And so letting go of needing to be right, and letting go of, you told me this and now you're telling me this, and so, oh, I'm sorry, I had the understanding that this, but let's keep going. And then it might come back out a little bit later. So those I'm sorry's will get you out of so much trouble. So oops, wrong way. The next gem state are emeralds, and these are people who are living in the past. And the challenge with them sometimes is they start remembering things from the past and overlapping it with the future, time traveling, and get really confused with that. For the ember people, they're really living in the moment. So they don't have a lot of language. They are using their hands. So a lot of times you can see their distress, but by how much they're doing with their hands. So they get really fidgety and they get really, yep, 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 yep. Well, you. When maybe one family member comes in the room and you see them starting to get a little fidgety, a little more distressed, kind of notice those kinds of things. Rubies are people who are living in that bubble. They don't have language. So you can ask them all day long and the words just, you might get a, yep, 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 or hep, 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 hep. But language is not going to work. There again, it's going to be more of that whole body kind of pulling away. For people in that pearl state, these are people who are really living inside themselves. They're still there, um, but their world is very small and they're still really living inside themselves. So they might have a moment where the blinds come up and they're there, but we're really looking at outside things for them. So we've talked a little bit about this exploitation things. Um, we've talked a little bit about that kind of rest. So let's spend some time. I know I'm getting close on time talking about identifying abuse. And so what I'm really looking for is things on that don't make sense, things on the physical exam that look inconsistent with what the explanation is. But it gets complicated because my folks are changing. Something as simple as, I'm going to ask everybody to stand up for a minute. So if everybody will stand up for a minute and put your hands out to the side. So that's normal vision for somebody age 25. Move your hands into about 90 degrees. That's normal vision for somebody at age 80. Put your hands like this. This is vision for somebody who is in that diamond state. So when we get down to this, we get down to this emerald state, we're now looking at people who have dramatic vision changes. And so they may have really dramatic falls downstairs that look like they must have been pushed, because nobody would just ever just fall downstairs head over heel like that. But with this vision, you don't see the stairs, things might happen. So really looking for those consistencies, looking for those inconsistencies, and paying attention to things on the physical exam. People, the kinds of things I look for those classic kinds of things like bruises. I look for the classic kinds of things like skin tears, because the difference, what I'm looking for is something that most kind of accident kinds of things happen on one side, but not on the other. So if someone bumps against the table, they may have a skin tear right here, but they're not likely to have that skin tear in the same place on the other arm. And that to me makes it look like that person was grabbed and there was some twisting going on with the skin, because people rarely bump themselves in the same place at the same on bilaterally. So I look for things that are more bilateral. That makes me more concerned about the possibility of abuse. I look for things that are at different so someone had a bad fall, and they've got new things on them, but they've also got a lot of old injuries. That makes me more worried that there might be abuse going on. Part of the real challenge is that people living with dementia are telling the truth. They're telling the truth as they understand it. And I wish there was a way I could give you, a truth serum, to kind of weed out what is actual and what is kind of confabulation and what is kind of misinterpretation. Um, but it's really hard to dig through those stories because people are really just trying to make sense of what's going on around them. So some strategies that can be helpful are really making that relationship looking at making that connection, getting into that position where you're sitting beside the person, thinking about mask. Also really allowing for pause, because people living with dementia often take more time to process. So they often take more time to really be able to respond. So I'm going to give you 10 seconds. I've got my timer set for 10 seconds. People living with dementia, you can ask them a question and it sometimes might take up to 10, up to 20, up to 30 seconds to respond. So I'm gonna, Stephanie is unmuted. So I'm going to ask her, and Stephanie, I have a feeling this might be hard for you, but I'm gonna ask you to not respond to me until my timer goes off. Okay?
Okay.
So Stephanie, is this place okay? Okay, so that was 10 seconds. How long did that feel?
It felt like 5 minutes to me
It,
because,
it,
I'm so responsive.
it feels like 5 minutes. So typically what happens in that 10 seconds, if we've already asked what?
If we've already asked, how do you like this place or how is this place? Your first thing I would say if I were on that side is I'd say, well, the food's not good and
Yeah.
they don't come every time I ring the bell or whatever.
Yeah. And so me as the interviewer, I might say, how is this place? And then the person doesn't answer. And so I move on to the next question, or I ask that question again, or I rephrase that question and ask it again. And so it's like the timer restarts every time. So it's
And
like,
that makes it longer and frustrating.
and we never get to the answer. Whereas that person, particularly in that diamond state, might be coming up with the language, coming up to see if they can trust you enough to really answer that question. So just being aware that 10 seconds is a really short period of time. So I'm a nurse. I have taken pulses forever. I'm pretty good at counting time. I also am the mom of a son who played soccer. So I am used to counting down how many seconds are left in this half or this game. So I count to myself, or if I'm really anxious, I'll kind of do my finger on my leg and count the seconds to make sure I'm giving that person enough time to really respond to those questions. So giving that time is really hard and really important. So let's go back to see if we can pick up a couple of more tips, knowing that I'm going to finish up in a couple of minutes and give you some time for some questions. And that kind of goes along with don't interrupt. When the person is processing, if they don't answer in 10 or 20 seconds, they probably lost the question. I'm also going to look for people to become physically withdrawn. So I'm going to look for people. We've been chatting, things are going well. I ask the question that kind of gets and their body language changes, their words change. I'm looking for those kinds of things. I'm looking for emotions and behaviors, because I'm going to assume that if a person is expressing that they don't feel safe, there's reason why they don't feel safe. And maybe they're not being physically abused, but maybe they're being yelled at, or maybe there are other reasons why they don't feel safe in this situation. That relationship is really important, and thinking about the environment, thinking about preferred name. That's why I will say, if I'm asking Stephanie or I'm asking Laura, I'll say, hey. So I'll ask Laura to unmute for a second.
Sorry, it took me a second to find the button again.
Happens. Hey, it's Melanie, and you are?
I'm Laura.
Laura. So now I know she wants me to call her Laura. So that's how I know if she wants me to call her Laura or Mrs. or Doctor or whatever. So that kind of gives me that little hint. What makes a difference? There's not a lot of research out there for a difference in dementia and abuse. There's some attitudes, beliefs that education makes a difference. There's some attitudes and beliefs that support makes a difference, that resources make a difference. But it's really complicated, especially when it comes to things like respite. Maybe that helps. Maybe it makes a huge difference. That's certainly one of the things that I've been hearing from my community is, I'm about done. He used to be an adult day program, 20 hours a week. And now that he's with me, 7 days a week, 24 hours a day, it is too much togetherness. I am done. I need help. I need out of here. So that's when I start looking, because the risk factors for this kind of elder abuse are often different. You often don't have families with a history of mental health issues, with a history of physical violence or drug and alcohol abuse. Often the families that I am dealing with are families who've never had this ever happen in their lives before. Life gets complicated and resources get limited and distress happens. And so sometimes with the people that I spend a lot of time with, I really wind up thinking, what really is safe? Is what's safe for them to be in this situation with some resources, with some support, with some education, or is it something different? So being aware, being grateful, working with your colleagues. But what it comes down to for me is, I call it that tickle in the back of my head, that tickle in the back of my brain that tells me something is wrong. And the majority of the time when I get the tickle in the back of my brain that tells me something's wrong, when I keep exploring and I keep asking questions and I keep I find what it is. So I want to thank y'all for choosing to be in this breakout. I want to thank y'all for being so responsive, for doing the work you do. I've got about 2 minutes. I need 2 hours, Laura. Laura, I need 2 hours. Don't leave the breakout room. I've got 2 minutes. No, do what you need to do. But I am going to hang around as long as they'll let me, if you want to ask some questions or if you have some comments.
Well, Melanie, do you have an email address maybe if people could reach out to you? Would that be okay to share an email address if people have questions that we didn't get to?
Absolutely. I'll put it in the chat. It's melanie.bunn@yahoo.com.
And is the Melanie with a capital M?
It's lower, but Yahoo doesn't seem to be real picky. Melanie.bunn@yahoo. Oops. Yep, that's right.
Yeah, thank you so much for a fantastic presentation. We really, really appreciate your time. So many helpful tips there. Thank you.
Thank you for inviting me. And if I can help with anything, just reach out.
All right, so if folks want to go ahead and leave the breakout room, we have a quick break from 2 to 2:15, and then from 2:15 to 3:15, we have our afternoon keynote, Michelle Gorino, who is going to present on trauma-informed care plus decisional ability aware interviewing. So should be a great presentation. All right, thanks so much.